It gives me great pleasure to introduce Dr. Khaled Hanoni. Hi, I hope you're here with us. He's coming all the way from Dubai, and he is a general practitioner, but he has interest in the cosmetic and the laser dentistry. He graduated in Syria 2011, and then he did the bird laser diploma at 2018. He's also a fellow of the ADI. So Dr. Walid must be seeing him often.
Yeah. Hi, Khaled. How are you?
At this moment, he's doing his master's degree in Rome
University.
Dentistry. Yeah. So hopefully, after all the COVID-19 starts to wear down, you can have a beautiful graduation.
Hopefully, we will see. We don't know what's going to happen. Thank you very much for the introduction, Victoria, Dr. Walid, Dr. Hassan, Dr. Tamer. Thank you very much for this opportunity to present our cases and share some of the science that we learned with your institution, the Bird. I will now share my screen.
Khaled, I have a question for you.
Yes, please. Tfadal.
What you are doing for your hair nowadays with this lockdown?
I knew you were going to ask.
Because yesterday I have the first experience in my life. I have my hair cut on my own. You know? But then when I make it, I ask what Khaled is doing now.
I changed the haircut. You can see that it's not high anymore. It's more of a...
It still looks great, so well done.
Thank you very much. So I'm trying to share my screen, but it's not... yeah, okay, now it's working. Okay. So, good evening, everybody. Thank you for this chance. I'm gonna have a small presentation about discussing clinical cases. So we will have two cases presentation, and I will discuss 2 points in relation to laser and cosmetic dentistry. First, I have to start with my relation with Bird. How did it start? I actually, I'm a graduate of the professional diploma in advanced laser dentistry from Bird in 2019. I had the chance to be educated by some of the top renowned dentists in terms of laser dentistry in the world, Dr. Walid, Dr. Giovanni, and my godfather in laser dentistry, Dr. Manaf Al-Agha. You can see also I had chance to meet a lot of people. One of them is my brother, Dr. Iman, who presented an amazing laser lecture now. And also parallel to Bird gave us a chance actually to have a fellowship with the ALD, the Academy of Laser Dentistry. So I'm also a fellow of the Academy of Laser Dentistry. Also in 2019, during the Bird, this is some pictures with some of the biggest names in laser dentistry world, Dr. Shigi Ganagai, Dr. Giovanni Olivi, Aaron Darbar, Dr. Ramin Tamastis, all of these big names were there. It was a great chance actually to meet all these people. You can also say that this was a chance for me to move to the next step of laser education, and I joined the master's program in the Cattolica University, the Catholic University of Sacred Heart in Rome, under the umbrella of our great mentor, Dr. Giovanni Olivi. And this program now is about to finish in July 2020 now because of COVID-19 situation. We are having to prepare each one from his country, and we'll have the graduation and the thesis discussion later. It's also amazing chance what Bird provides in terms of, just like my friend Iman said, it allows us to have to meet new people from different cultures, to exchange different visions of how we apply science, especially in laser dentistry in my situation. My family, this is my wife and my little angel Jasmine. She's 3 years old. I'm originally from Palestine, from a small village that was occupied in 1948. It's called Al Fallujah. My mom is Syrian. She's from Damascus. I was born in Syria in Damascus, lived all my life there, and I studied dentistry there as well. My wife is from Belarus, but her mom is from Poland, and her dad is from Russia. And my daughter was born in the US, and we all live in UAE. So technically, we have United Nations at our home, multicultural environment. You can imagine how is it going. So going to our topic, I'm not gonna discuss laser dentistry. In my presentation, as I told you, I'm gonna talk about smile makeover, having something from each specialty in terms of cosmetic dentistry and laser dentistry. In laser dentistry, I want to give you an idea about laser dentistry. My understanding of laser dentistry is a laser assisted dentistry. So it's a science that assists all specialties of science. I know many of my colleagues in different specialties, orthodontics, endodontics, periodontics, they have their opinions about lasers that, yeah, you give it more than in terms of, yes, it doesn't do everything, but no, laser is a tool. If it was learned the proper way, it will give you a great outcome and it will make your life easier. I see it as a tool that will make your life easier and your patient happier. So why not to learn how to use this tool? And just like my friend Iman said, sometimes if we don't know something, we start to fight it. I believe it's the future of dentistry. It's a new tool that will be available on each dental chair in a very soon, very soon. I'm gonna discuss two main procedures in this two cases discussions. We'll discuss smile makeover, but I want to concentrate on 2 points. The first point is the laser depigmentation. Laser depigmentation, I will not go back to the definition, just like my friend, he already was talking about, from Sudan, he was talking about the laser depigmentation. Pigments, it has many reasons. This is as Kamura et al. You can see that there is inherited reasons and acquired reasons. So the pigments on the gum can be differentiate according to the reason. It could be racial or acquired, which can be smoking or some diseases or even drugs consumption or even amalgam tattoo. Now, this is an article again for Dr. Manaf Al-Agha. This is a recent one. It has a comparison of 3 different sizes of laser, just like my colleague discussed before. There are different types of lasers. There are all tissue lasers and there's soft tissue lasers. There's different wavelengths. As a comparison, this is a very interesting article for you to read if you're interested in depigmentation. It has a summarizing of the pigmentation in general and what is the difference that you will see between each laser and another. And the conclusion in this study was that all of them did very well and all of them were having amazing results, but it needs to be further studied in terms of many factors related to the parameters of each laser. Now, of course, the pigments can take many shapes, either spots or can be patches, depending also the classification to be, is it dark, is it like a solitary, or is it formation of continuous ribbon of pigmentation? Each one also will initiate what form of parameter you will use. So the darker the spots are will give you an indication to use lower power parameters to remove it, because the chromophore, which is the absorption, will become much higher. So you need to apply lower powers. Personally, of course, there are a lot of articles you can see, and there are some articles comparing it with the normal blade depigmentation or bird depigmentation. This is a picture you can see of a case I did recently, and I did half of it depigmentation with the diode laser A10, and half I didn't. It was like I took this picture because I found that you can see here that there is no bleeding. It's a clean site, dry site, clean site. There is no bleeding, and the healing is super fast. You can see the diode laser as a result compared to the blade. In this study, it tells you that it has a dry operating field. It reduces the pain perception. It's of course compared to the scalpel, and also because of course the laser is absorbed. This type of laser absorbed in the hemoglobin, and it does somehow coagulate the proteins in the nerve endings, so it forms more of a painless procedure and more comfort during the healing process. Many of these cases, patients, they usually come and ask of, like, after procedure, do I take medication? Do I take painkiller? Most of the time I tell them, yes, you might need to take painkiller in the evening if you have pain. Now, they call at night and they say, doctor, I don't have pain. Should I take a painkiller? It's a very pleasant procedure for the patients. The cases discussion here, again, I want to talk about first case, like this depigmentation case. This is a patient with a severe pigmentation, big patches, dark. He has a thick biotype, which is also a main thing to consider when you do depigmentation and to set your parameters. The laser I used here was a diode 10, 110 nanometers. The pulse mode was digital pulse mode, what is called by this company as a DPL, digital pulse laser, known as super pulse. And there is a pulse duration of 26 microseconds. The parameters were 5 watts peak power. We're talking about peak power, but it's pulsated in 12,000 hertz, so the average power is 1.5 watts. The angulation of this procedure, when you're using the tip should be initiated, of course. Non-initiated will cause a disaster. If not, it should be done by a trained practitioner. The laser tip should be initiated, and the angulation should be between 5 to 20 degrees. Now, the concept parallel is not really applicable. You will see it in many articles saying parallel, but parallel is not really applicable, because being parallel to the tissue means the tip is not touching by its end. The body is the tip touching, so it will not be really effective. So the angulation, in my understanding, should be 5 to 20 degrees. And here I use the tip 600 fiber. And this, the bigger the tip, you have to remember something, that here you have a big area of depigmentation. The bigger the tip will allow you to remove bigger surface. And the most important thing is the density of the energy you're using, you're generating while you're doing the depigmentation. So the bigger the tip is, less the penetration, the more shallow the penetration is going to be, less and less thermal damage. So you avoid with the thermal damage. If you avoid the thermal damage, you'll technically avoid having any undesired healing, delayed healing, or even pain for the patient in worst case scenario, ulcers or necrosis. Of course, the touching, the procedure will be angulation, 5 to 20 degrees angulation and removing. I'll show you now this video of this case, and here you can see, this is, by the way, just one slide back, I did this pigmentation in one session, and you could see the result after 21 days. My concept of doing the pigmentation is that sometimes we have deep pigments, and these deep pigments, I personally don't like to remove it completely. So I do layer the layer where I see that I gave enough energy there. So I stop and I give the body the chance to heal and let's say cool down on the tissue to heal. This result after 21 days, it will give me an idea that yes, this is the final healing, we can say. And then if there is any patches left, we will do a touch-up. And this was the visit where I was doing touch-up. I always tell the patient, of course, that the visit, this procedure might take many sessions. I will not finish it in one session, because it's also more comfortable for the patient. For such pigments, I might cause some more undesired effect of slight heating of the bone. Now you can see here, I usually use some water drops while the pigmentation, just to cool down the area and to reduce the effect, because here I'm using 5 watt peak power and pulsated 12,000 hertz, and the average power is 1.5 watts. You can see that here it's peeling off the angulation. The tip is initiated and it's removing this pigments, this layer of pigments. After that, of course, you have to keep on cleaning the tip, because the tip is you see the tissue accumulated in the tip, it will affect the overall power. Now there is a gauze. I hold the gauze, I clean the tip, and also I remove this part of the tissue, which is the epithelialized orbit. See, we clean the tip with the gauze. And we clean the site here to show, like, now you can see that the effect here would be mainly that because of the power parameter of laser I'm using, it will be somehow coagulating. You can see there is also some area that is slightly white. This area had more energy, which resulted in having some whiteness because coagulation is deeper. This is something usually one of the undesired effects of lasers if not apply the proper parameters. What happened here is that he has thick biotype and thin biotype, and you can see the upper one. Continue with the slides. Now, some of the cases and the follow-ups, you can see that the first case, I don't have the pictures actually after the second session, but yeah, well, it got better. We have also this case, you can see different classification, different pigments. It can be in different biotypes of gingiva. And here you can see in the second case, there is slight recession in the papilla because at this part of the gingiva, the pigment was extended on the papilla. So this picture was only 9 days after the procedure and the gingiva shrinked a little bit. It will regain after, it will go back again after 2 weeks. We can see third case also and fourth case. What is the uses? What is the really benefit of depigmentation using laser? And what is the advantage compared to the normal procedure we use with blades or with the burrs? You can use that. It is, of course, effective results. It's a fast procedure. Usually it takes around 14 minutes to do it. It has a fast, favorable healing, and it gains the thick tissue back. I'll show you some pictures with the epithelium healing. And we have a predictable outcome. Of course, more patient comfort, which will result in more referrals, in addition to dentist comfort, because when you can do procedure, very confirmed that you are leaving a sterile site in terms of the procedure you've done, not sterile, a decontaminated site, and painless procedure, the patient is comfortable after that, you will really appreciate this because it's less hassle for you as well. And the patient will appreciate that you did something that changed him and gave him cosmetic procedure with minimum side effect. The relapse rate as well with the lasers is confirmed in some studies to be slower. So there is relapse with these cases, especially if it's a racial pigmentation, but it does change the behavior with time if it's repeated routinely. Now, this is a case where I'm gonna discuss more as a laser and cosmetic dentistry in terms of also doing some restorations. Here, this is a case of my patient. He is a 30-year-old male. He had an orthodontic treatment previously, more than 8 years ago, and you can see that the surface, the four centrals, the upper centrals, they are damaged, the labial side. He had, he was telling me that the doctor was, the enamel was broken when he was removing the brackets. I believe there also was caries, because after I removed these fillings, I could see that there is caries underneath that I had to do restoration again. The patient's main concern was that he doesn't like his teeth and he doesn't like the dark gingiva. So these papillas, you can see the patient can see that it's dark and he wants to get rid of it. He's a cooperative patient. You see his concern again, the dark front teeth and the bad filling after braces, the broken part of this tooth, the surface, you can see bad fillings and dark spots on the gum. He is not confident with his smile. What is my treatment plan? My treatment plan was to remove these composite and see what's underneath, which turned out to be really deep, deep caries, and doing a build-up. I was more comfortable with doing for him a ceramic restoration to avoid the discoloration later with the composites, because the patient he came originally, by the way, asking for a Hollywood smile, which I could convince him that you don't need Hollywood smile here. You have a nicely aligned teeth, but you know, the media, the Instagram thing, just giving people more of this need of I have to change my smile and make Hollywood smile. So the treatment plan was to do the cosmetic procedure, restoration for the upper anterior, for anteriors, and the composites. You can see here I did the depigmentation, and here for him you can see the peeled off epithelium, and the angulation of the hand, of the tip, you can see around 5 to 20 degrees as well, with slight irrigation and cooling. Suction is very important because when you're doing the laser, there is smoke coming out, and this fume is usually it has a problem with cross-contamination if the patient has any viruses, so we should have high volume suction. You can see here, this looks nicer here. I used a little bit lower parameters that allowed for more bleeding. So when I reduced the power of the laser, I had more bleeding. And on this part with the red arrow, you can see that here the gingiva was irregular, so a little bit more. I will go back, show you. It was a little bit more swelling, needed some gingivoplasty, and we did depigmentation. You can see clean side down. This bleeding most probably I initiated by the gauze, because after doing the depigmentation, I just pass with the gauze on this area, and with the pressure I initiate some bleeding. Now you can see I did preparation for the teeth as well. I changed the restorations. I drilled. It was really deep, and the central incisors, they had really deep recurrent caries, and I cleaned them. I placed a new restoration and did preparation finish line, and we are going to do the impression. Now, before the impression, this is the second topic I want to talk about in terms of laser, and this is an underestimated topic. I looked all over the internet. I really didn't find much of the articles talking about troughing. Troughing is a procedure. Of course, gingival trough is the narrow space between the free gingival margin of the epithelium and the adjacent enamel of tooth. Troughing is an alternative to the retraction cord, tissue retraction by laser, which is called troughing. And here are some studies comparing the normal troughing with the retraction cord and the troughing with the lasers. The result was showing that there is improved regained tissue gained back, more thickness after troughing compared to the retraction cord. And in addition to providing, when you do the laser, I have already mentioned that it causes hemostasis. So technically, when you place retraction cord and you have some bleeding, especially in inflamed sides, like you saw, I did gingivectomy, I did depigmentation with a bleeding side, and I did preparation and impression on the same day. This is impossible to usually do with a normal procedure with a blade. So now laser didn't only make it easier for me, but also opened it a new dimensions, let's say, for me to be able to finish the procedure in one session rather than doing lasers and preparation and putting temporaries. So it will provide a sulcus hemostasis. He will reduce the cervicular fluids, and it will decontaminate the sulcus. Now, this is the protocol I use for the troughing usually, and this is a protocol that is recommended actually by the manufacturer of this laser. The laser is 810 nanometers. Again, the parameter is 1 watt continuous wave here I'm using. And it's not a pulse laser. This is a continuous mode. The position is around 0.5, 0.75 millimeters in the sulcus, sometimes less depending on the depth of the sulcus, and I always prefer to do it with a healthy sulcus without recessions or inflammations. Of course, the procedure will be more of penetrating inside the sulcus and going in a round motion or circular motion around the finish line without penetration or going down to the floor of the sulcus, because all what I want to do is to remove 0.2 to 0.5 thickness of the tissue to provide a space for the impression material to fill. And this is the angulation. You can see here the tip is going inside the sulcus, giving removing part. And in this tip, this is 400 microns fiber tip, and I place it there. I go around the finish line, and it will give me some space and dry, bloodless site. So it will also help me in the situation to form more hemostasis with the 1 watt continuous wave. One of the functions and application of laser is to use this. Now, another one with a deeper site, you can see the impression after laser only. There's no retraction cord. Finish line is clear, and it will really give you a very good ability to do a proper impression. Placing a temporary is very important as well, and to have proper healing. This is the healing after 7 days. You can see inflammatory healing process on the left side of the patient. You can see the healing after 19 days, it's improved more. And this is the situation after 13 months follow-up. You can see the epithelial healing. Here, the gingiva, where we did depigmentation because I was very conservative in terms of applying it in the thickness or angulation. it allowed me to have a proper healing with the epithelial healing here, what we call it the orange peel stippling gingiva. The transformation in general was like this. The patient was very happy, and that's our aim. There's a second case. Do I have time, Victoria, to discuss it, or should I stop?
Well, unfortunately, although I love your presentation, I really wish you have it.
I started late 5 minutes. Is it okay?
Hassan?
Are you going to give us a take-home message or the feedback?
Yes.
Or...
Yes.
Yes. Go for that. Definitely.
Thank you.
So this is another case where there is also, she has fluorosis. You can see the spots of fluorosis. The option was to do composite for her in the beginning. The patient asked she doesn't want composite in the on the anterior upper teeth because it will get pigmented, so prefers something else. We did again preparation for these, and the lower ones we will do composite. Again, I did the troughing in this side with the same. You can see the effect of removing some of the tissue, taking impression again. It's repeatable. It's possible to repeat the same application. And you can see also put temporaries, place the veneer and the patient. This is immediately after cementation. And the transformation was like this. The patient was happy. I did composite on the 4 lower teeth. Now, what is the take-home message? Take-home message in my point of view is laser dentistry. It's in general, in cosmetic dentistry, we have to use all the means we have to provide the patient with not only a healthy treatment, but to also give the patient a comfortable treatment. Dentistry now is not only about providing a good treatment and a healthy treatment. It's about providing a more comfortable treatment for the patient and to make him happy with the latest technologies. So laser is one of the tools that will aid you in your practice, and it will really change your practice. And my advice to everyone, of course, not to be afraid of change and to learn the laser, because it is one of the things that will help you to grow and will change your life. Makeover is not always about only doing 20 teeth upper, 20 teeth lower. Gives you patient a chance to keep his healthy teeth and be more of a doing minimal treatments, and you can affect your patients. These 2 patients came with a Hollywood Smile request, and I could switch them to have the more conservative treatments. Minimal invasive dentistry is what we have to concentrate on. Thank you very much for your time. Sorry for being late, but yeah, that's it.
Khaled, thank you very much. Keep the last slide, the one with thank you. Thank you very much. Rich presentation, well presented lecture, and loving the last take-home message. Everyone, this is Khaled's Instagram and email. Please get in touch with him. I'm sure Khaled will be more than happy to share his passion with you, to share his knowledge. And it's just amazing having you, one of our graduates. The laser diploma we've done in Dubai was one of the most successful laser courses on global level. And to see our graduates progressing like this is amazing. Waleed, would you like to add a comment?
Thank you, Khaled. As I expected, I am not surprised about the levels. Everything is great. Just I read the comment. There is one question I want you to answer, because maybe you send not the correct message. Why not to complete the depigmentation in one visit?
Now, there is a different approach. As you know, you have a different approach, Dr. Waleed, I believe. And also
just to clear your home message to make everything easier for the patients and minimal invasive. Why I need to bring the patient after 3 weeks, I make the procedure again. I make it more complicated. If I can achieve it 1 time, what the logic to make it in 2 times?
If the patient has some form of classification, I didn't discuss the classification thoroughly there, but if in some cases the patient has deep pigmentation, and big spots, I prefer usually to do it in sessions, because
how much the depth?
There's you're going the depth.
And
exactly.
The maximum we are talking about 400 microns. So any procedure with laser 1 stage, you can do it, remove 500 micron, half milli, and you do it in 1 stage. Just to say, I know you do it in 1 stage, but some of the audience, I read it in the question in the chat, they ask about this question. So this will be a drawback for the laser if you want to make it in 2 or 3 stages, because we make it more complicated. But actually, you could achieve.
Tell you this, I tell the patient usually in multiple sessions. I don't do it always in multiple sessions. In 90% of the cases, when I do the procedure, I try to finish the whole pigments in one session. Only in very low percentage of the cases, 10% of the cases where I have the pigments, after removing a thick layer, I still see pigments, I leave it. What happens usually when I follow up with the cases, and I will share soon an article discussing the changes that happen in the tissue even after each week. So on the first week, the patient will feel that the pigment is less. And even without doing a second session, on the week after, the pigments are less, because technically, the laser which absorbed by the melanocytes, technically ruptured the melanocytes, it was still there physically, but then it gets absorbed by the area there. So the laser doesn't need, in 90% of my cases, to do touch-ups. But I prefer in general to have with the deep pigments to do it on 2 sessions. I never did the 3 sessions, to be honest with you. Very minimal cases, I did 2 sessions. I wanted to concentrate on this case because I see in many of the colleagues sometimes that with such cases, they keep on going deeper, deeper, deeper. Unfortunately, they cause some thermal damage.
Yeah, I agree with you. But again, it's how to play with your parameters.
Sorry, I'm disconnected.
Yeah, you're still.
Okay, because we're moving to the next.
So, it doesn't. My first point here is being minimally invasive and more comfort for the patient. But again, Dr. Waleed, my answer is no. In 90% of the cases, 1 visit is enough. I just prepare the patient for more sessions if needed, because usually if you do something to the patient and you don't prepare them before and then you tell them this happened, it's more of justification. But preparing the patient is really a very important point. That's what I tell the patient. 90% of the cases I do it in 1 session.
Okay, thank you, Khaled.
Thank you very much.
Khaled.
It was an amazing finishing or completing of the laser session today. Thank you, Khaled. Thank you, Dr. Ahmed. Thank you, Iman, for really top quality laser presentations. And thank you, Waleed, for joining as moderator for the laser session. Always nice to have you with us as part of my good brother, Waleed.